discussing about mental health awareness. We discuss about the role of mental health and how it affects individuals. So with me here is
Evarista. Hi.
Samuel. Hi. Max. Hi.
and my name is Emma Blessing. Stay tuned. You guys know what it like? Do you have any understanding about mental health? What do you know about mental health?
Well, can I jump in? Yes. Okay, so I feel if we want to talk about mental health, we want to break the words into two: mental and health. So health is a state of well-being, total well-being. And mental has to do with the person's thinking faculty, the person's mind. So we're looking at the person's brain here, we're looking at the nervous system. So I would want to say mental health is the total well-being of a person's thinking faculty. So it's the person's ability to be able to say, okay, yes, I'm okay, my mind is okay, I'm fully aware of what is happening in my surrounding, oriented in time, place, and person. So yeah, that's mental health in my own definition.
I think she has exactly because to add what if you the psychological well-being of an individual is in brief mental health. Or did I add bricks upon?
Yeah, the cement upon the bricks.
Okay, so I think that's that.
Okay, that's okay. That's okay. So the next question we have here is what type of we have different type of mental health disorders. I think you already mentioned some. I don't know if you what type do you
something I can't remember, but the old name is multiple personality disorder. You have ADHD, you have OCD that many people claim they have.
Everybody.
You have OCD. Then the one that I'm very peculiar about is bipolar, because even up till now nobody actually knows that the major trigger to bipolar. You can trace OCD, you can't really trace. These are like but a few common mental disorders that I think that are common. There are still deeper ones.
There are some that I feel they are even too shallow. I mean, like for example, some persons might today that maybe actually love playing football or they love watching TV. Then suddenly they start losing interest in that. That is something that's taken very, very, very seriously.
I think that's the classical phase one of mental health. That's losing interest in what you used to enjoy.
Losing interest first you that normally one season one
should really
come
talk
out.
about this mental health from now till tomorrow. We still won't be done. True. But at one point in our life, depression it just comes and then it goes. Sometimes you won't even realize. Like you said losing interest in what you used to do is most times a sign of depression. It's a sign of mental health breakdown. So we need to make the public know these are the signs. Don't just feel you are normal and you feel it's just normal for you to lose interest.
It's the little things, folks.
Exactly.
Little
Things
things.
that matter the most.
Yeah. Thinking of anxiety, as much as people think anxiety is just, I'm anxious, I have an exam, I have a test. Anxiety is also, and most times it's actually a mental disorder. So anxiety stems from, it's not just, why, maybe some people will sit and say, why this person is always anxious. That's just how the person is, or that's just how the brother is. Not knowing that the person is actually going into, the person is actually having a mental breakdown. And the thing is, if you can actually start diagnosing it, you can actually start realizing it or noticing it from when it's that small, you can actually be able to curb things like depression. Because most of the time, I had this lecture I attended, and this lecture was SAD. That was the name of the lecture, like SAD, SAD, and it was stress, anxiety, depression. And they explained how you could easily move from stress and go to anxiety and then full-time depression. Most time the internet focuses on depression as just the mental disorder, and some others like bipolar, and they don't realize that somebody being in this stressful state, being always anxious, is actually a mental breakdown. It's just like carcinoma in situ. Mental breakdown in situ.
Okay.
What do you have?
First of all, we have to understand that the reason why people don't speak up is because of one thing: ignorance, basically. There is this stigmatization that when you talk about mental health, the first thing people think about is psychosis. First thing people think about is either you're running mad or you're a psychiatric patient. People don't really understand that mental health boils down to both your emotional well-being, not just your psychological well-being, emotional well-being. If you're talking about depression, it boils down to emotional well-being. So you don't just attain depression to just basically somebody who is mad. Now, if this understanding is there, it will be easier to speak up. So I think the advice we should give to people is not an advice, but it's creating this safe environment. I, for one, personally have been opportune to speak to people suffering from various mental health disorders like bipolar, anxiety disorders, and stuff like that. And there's one thing they always say: if I speak up, people judge me. So if
almost at the time, so some people do not take them serious.
Exactly,
Like,
they think it's a joke.
I was talking to someone a few months ago. It was like, is there really anything like people who are bipolar? Is that really a thing? So many persons do know. We started to find ourselves in today. Many persons do not actually tend to actually feel what this is actually.
You think it's America? It's
a white man.
They feel depression and all of this far from us. They don't know that it's between us.
Exactly.
It happens around us.
It's closer than we actually think. That's why that safe place is not there. Imagine now telling. I had a friend last week. She told me of her anxiety has given her insomnia. She has not slept for 4 days. Not like she has not slept for more than 1 hour. She has not slept at all. Every night she's always awake. Like she has this constant palpitations. Then
and if you do somebody like that now, if she tells someone that how you say you don't sleep for 4 days, how you say you don't sleep for 4
I'm going to the
days?
sweet part now. Wait,
Okay,
I now
okay.
told her that go and see a psychiatrist. She asked me, psychiatrist. I never decrease. Like you see where the problem comes in. She has this-
Her own self.
Exactly. We just have to try and create a safe space and also be advocates of mental health. If I come to you and I tell you that I'm depressed, you don't tell me how far you became a man. You be man.
Man up,
Exactly,
man
man
up.
Who said man cannot be depressed?
Thank you.
Yeah.
And if you check statistics, the rate of suicide has increased in the male gender than in the female gender. Then if a girl comes and say it's a monthly issues and she's depressed because she maybe her hormones. Exactly.
So it's not like it's only females that are allowed to be depressed.
But then again, they believe that it's hormones.
That is a logical explanation.
Explanation, but there is none. So it's just safe space, creating a safe space.
It's okay. I hope we will be able to fix this. That's the reason for this whole discussion. We'll be able to know that depression, coming outside to express how you feel, is not in any way bad. There is no stigma attached to it. Forget about the stigma. Come and seek for help. Because you can't just stay indoors and you expect. Sometimes it gets worse staying indoors. Just come out. Tell your close friends. Don't bother things. So your close friends will be able to help you.
Let me chip in something. Like for the medical students now, we have medical student association.
Okay.
Now the medical student association, they've brought up a committee to try and advocate, because they know that medical students are in a stressful environment. We are prone to mental breakdown. We are very, very prone. I'm currently in a training program on mental health, and someone said something in one of the last classes. He said, what triggers your current mental health breakdown is the constant stress. That's what Nat jokingly said. A medicine student left the group chat, and then she said it's true that medicine students, they constantly. So now it starts from your environment within. I see you are stressful, and I try to relieve your stress. Well, okay, I complain that this stuff I already is too much. I won't tell that we still have exam tomorrow. I'll probably tell, okay, take like 5 minutes off. Take like 5 minutes off. Take a break. Then I learned a new technique recently. It's called the breathing technique. How do you do it? You take in breath. You breathe in and count to 10 in your mind. Then you breathe out with your mouth open. You do it for like 5 to 10 minutes. It's relax.
I know many persons will be actually thinking, does this thing really it works? Actually, exactly.
It works, guys.
Actually,
Just
it
try.
works. You breathe in. count to 10. You can count as much as you want to your level. You breathe out with your mouth open slowly. If you take a break, it's
Just
very,
take a break.
that is very important.
Very important.
People don't do that, you know.
That's true.
Take a break.
Whatever is stressful, just take a break.
That's the
That does not mean
avoid
you
the
should
stress.
withdraw totally. I know we mentioned that losing interest in what you used to do before is a sign of depression. There is a thin line between taking a break and then losing interest. If you know that this particular thing is stressing you, just take a break from it. So, do you have any other tips? Or
One last thing, sorry.
Okay.
Prayer is very, very important. Prayer is very, very important. And one of the ways I used to do my own is through chants. If I feel so overwhelmed most times, I just take my AirPod, the highest volume. I have a playlist of chants. I think I shared it with someone when we were coming back from one outreach. Once I just play those plays of chants, I just open up my mind. Sometimes I start crying. Like, I'll just look myself. I don't really care people say cry, man, I
Crying
cry.
is
Like,
therapeutic. Why would
just
you cry?
pray, like, just exactly. Open up.
You are broken.
Open up. Someone told me in secondary school, I'll never forget. He said, the first way to throw entrance into God's presence is praying as a clay pot and God as a potter. You tell him, break me
The one
and
that
remold me.
removed. What has been broken? Only what has been broken that
I
can
can remove
remove
it. So
them.
you go
Yeah.
there broken, open your heart and pray. Like you don't need to talk. Your tears will speak. Someone who is depressed does not have prayer points. I've noticed it. The first thing is, when you open his mouth and tears just coming out. In church you say, this one don't down anything. This one is not down anything.
Yeah. This is just mute looking into space and like this one is
Prayer-
God is saying something, God is imprinting.
Prayer works in God. It works in God. Forget the medical.
There's something there.
Yeah.
Forget the medical aspect. Prayer
Yeah.
works.
Okay.
I think the only thing I want to add here is that I want to just encourage anybody who is out there going through anything at this point. Don't get tired, because sometimes, like we've said, you can come and you tell maybe a doctor and they'll be like, and they will trivialize the symptoms you feel you're having. So people have actually tried to see people and maybe friends, doctors,
Yes.
or anybody, and maybe even their parents, and they've trivialized their feelings or their emotions. I want to encourage us that we should continue. There's just going to be one person that's going to hear you, and as he has said, pray. You never might know. The seminar I attended was stress, anxiety, and depression. I was actually depressed that period. I didn't know I was even going to attend. I just stumbled upon attending the program, and it had really helped.
Talk to God. He's the only one that listens, even though you think he isn't.
Yeah.
I dropped my mind there.
Drops mic.
Exactly.
Drops
Thank
mic.
you so much. Like, we all seem to be talking from experience. Because these thoughts are personal from one seminar. What are you doing in seminar if you are not really depressed?
To be honest,
Okay, pray that God helps us. I think that's all. Thank you so much. Bye. Okay, I hope you've learned a lot, because I really learned a lot from the mental health advocates. As they've said, they said speak out, talk out to them. So whatever form of mental breakdown you are passing through, always seek for help. And remember, Jesus said, cast your burden on me. So guys, please like and subscribe to our YouTube channel. Bye. It's 118 show AAU ISTH chapter. Love you.